Thank you, Cameron. Good morning, and thank you very much for the invitation to speak with you. As you know, as Cameron said, I'm Diana Kielian, the Senior Vice President of Mission and Ethics. You know, the best titles are the short ones like CEO, CFO, COO, God. So I always tell our employees I'm God. Just a comment, given the theme of what's been said this morning on Rotarian comments, if on the back page we have a sobering center that we talked about, so I was thinking that might be useful. We also have support groups, so if you want to partake, we gladly have you as a part of that. What I did put at your tables, though, is a report to the community that we do every single year. It is not a financial report, but it is a short synopsis of what we call our reaching out into the community. And so it's there for your perusal. We'll be putting another one out in October. I've been at Franciscan for 15 years, and I have to say, I have yet to have a bad day at Franciscan Health System. In fact, as I was driving here this morning, I thought, it's a great day to be an employee at Franciscan Health System. What's real exciting to me is, regardless of what any of us may think about the Affordable Care Act, the Health Care Act, regardless of where you stand politically on health care, this is an exciting time to be in healthcare because we are changing or having a paradigm shift. And the last paradigm shift in healthcare came in 1963 with the beginning of Medicare. And so I don't know about you, but I'm excited that in my lifetime I get to see that change. Let me talk about Franciscan Health System and who we are. You know, we just keep growing, and we are more than hospitals. But we started out as an acute care facility in the Hilltop, St. Joseph's Medical Center. We are currently now 5 acute care facilities with St. Joseph Medical Center in Tacoma. Tacoma was started in 1890. St. Francis Hospital was started just 26 years ago in 1986, 87. St. Clair Hospital used to be Lakewood General, and the Sisters of St. Francis purchased it in 1991. St. Elizabeth Hospital was Enumclaw Regional Hospital that we affiliated in May of 2007, and then St. Anthony Hospital, which was built from the ground up in 2009, we opened that hospital. We're pretty excited about not only having facilities, but it's more about serving the community. We also have a very strong Franciscan medical group, and this is a collection of both primary care physicians and specialty physicians. We have over 90 clinics and a huge amount of number of physicians. We're also very, very proud to have Franciscan Hospice House. It is a 20-bed inpatient hospice facility besides a very large outpatient or home hospice program. We are the largest hospice program in the state of Washington. We are among the top 10 hospice programs in the country. The Hospice House is the only one of its kind south of Seattle. We are hoping in the next 5 years to open a similar hospice house in Federal Way in South Kane County. Some of our key services include, obviously, the acute care services, is having inpatient care. We are the bariatric center of the Northwest. We do bariatric surgery and services at our St. Francis Hospital. Cancer care, you can see the list. Some of the things that we're really proud of is St. Joseph Medical Center is the premier heart center in the community. So if if you are in need of heart services, you know, St. Frank or St. Joseph is the place to go. I can personally speak to orthopedic care. We probably have the best orthopedic surgeons in the Tacoma area. We are blessed to have two great healthcare systems, Multicare and ourselves. And for those of us who get older, you know, and need joint replacements, I will tell you, we have the best surgeons in this area. I'm a living, breathing example of 2 knee replacements. And absolutely, you know, the rest of the body's going to die out, but my knees will live forever. I was in the garden this weekend, and let me tell you, it was so exciting to be there for 10 hours, whereas a couple years ago, it was like 2 hours, a lot of ibuprofen and ice. So it was pretty exciting. One of the other things that we're very proud of, and this is a partnership with the state of Washington and Multicare Health System, is our trauma services. You know, those of you who've been around a long time know that it was difficult not having trauma services within our own community, and now we do not have to fly people up to Harborview or send them to Madigan. We have trauma services right here in our community, and we're pretty excited. So every other day, it's, you know, one day it's at Multicare, the next day at Franciscan Health System, so we're pretty excited about that. Let me tell you, you know, we have all these services, and even though it seems that we're a big business, we really are grounded in a mission. And we in our organization, I always tell new employees, we do not have to apologize for using the word God, because we are a faith organization. But in an organization that steeped in the Roman Catholic tradition, but very inclusive of all traditions. And so our mission really is to nurture that healing ministry within the communities that we serve. And the last statement is the one that every one of our employees grab hold of, and that is, we hope to create a healthier community. That is what we're here for. A community that is healthy economically, educationally, socially, and physically, and mentally and spiritually. That's what we're about. So it's reaching beyond the healthcare or the hospital walls. So we have a very strong outreach into the community, and most people don't know this, but on the average, since 2001, Franciscan Health System have given back to the community about $500 million in uncompensated services, whether that is traditional charity care, so a person comes to the hospital and they don't have the funds to pay, that is traditional charity care, and they tell us right up front, or in subsidized services, like we're in partnership with Multicare and the Metropolitan Development Council on the Sobering Center, like we're with Medical Teams International providing a dental van down in Lakewood. So those kind of services. Just in last year alone, Franciscan Health System gave $81 million back to the community. So when we talk about being a nonprofit, what that means, that doesn't mean that we don't make revenue. What that means is our shareholder is the community, is giving back to the community, and that's what our commitment is. So our mission really is our compass. It is our true north. It is what guides us on a daily basis. As I share with our employees, you know, you hold the mission up like you hold in the Christian tradition. If you go to any faith tradition, religious service, as they hold the sacred book up, we hold our mission up, and that's what guides us on a regular basis. Our family is 8,300 employees, and that's pretty exciting. I made a commitment that I would know most of those employees. We keep growing. I don't know all of them. Close. I don't know all of them. I've been there 15 years, and we keep getting new ones. We have over 1,400 medical staff that are associated with Franciscan Health System. And we're part of a much larger system called Catholic Health Initiatives. Catholic Health Initiatives was a national system that was also founded by the Sisters of St. Francis, who brought St. Joseph Medical Center here. In 1996, the Sisters of St. Francis said, there's so many. They had organization on the East Coast and the West, and they said, we ought to do something that would bring together more influence in the public policy area. So collectively, the Sisters of St. Francis, with the Sisters of Mercy and the Sisters of Charity, got together and said, let's form a national system. And so the national system is headquartered in Denver. This is where Catholic Health Initiatives and our parent corporation resides, or in the states where we have facilities. The national office is in Denver. In Washington, our region is Washington, so Joe Wilczek, our CEO, has responsibility for Franciscan health system in Tacoma, in this area. He also has responsibility for 2 markets in Oregon, in Roseburg and in Pendleton. We encourage our employees and hold up a value of excellence every day. And so by doing so, one of the byproducts is receiving some awards. One of the awards that we've recently received is being one of the best clinically integrated healthcare systems in the United States. We share that title with our colleagues and partners down the street, Multicare Health System. So that's a little bit about us as a healthcare system. Let me just tell you what's happening. Those of you who've been in the Hilltop area know that we have a huge building going up on J Street. It's what we call, will be a destination center where we will have housed in that building some of our Franciscan medical group practices. So you can go there and then cross the Sky Bridge over to the hospital and get your radiology done, your lab services. So everything will be right there, but it will be a medical office building that will service. We will have women's services in there, family practice, nephrology services and neurosciences in that building. Around the building, we will also have little pocket, what we call pocket parks, insetted into the building where the neighborhood can also, as they're walking, can sit and enjoy the outside when it's sunny. So we're pretty excited about that. We're also building a destination center or a medical office building in Bonnie Lake. And that will be a place that's in between Tacoma and Enumclaw, and so we want to make sure that we have physician practices in areas of communities that seem to be underserved by family practice physicians. Family practice physicians are at a premium right now. I mean, there's a shortage of family practice medicine across the country, and so we are working very, very hard to get family practice physicians here. And then the last thing I want to talk about before I open it up for questions is, because I'd much rather hear what you want to answer your questions about healthcare. But let me talk about clown ministry. One of the things, for those of you who I haven't met or don't know me, many, many years ago, I was a Sister of Mercy for 23 years. So I was a Catholic nun for 23 years. And the only reason I came to the Northwest is because I left the religious community, and in the system I worked in, they knew me as sister. So it's kind of, I kind of needed that change of identity, a fresh face. But when I was in the religious order, I was just a baby nun then, and one of the sisters said, "Oh, Diana, why don't you dress up as a clown and jump out of a cake to celebrate our 125th year of existence?" And I thought, well, sure. She was older than me, and in the sisterhood, you respect, Mother Superior. So I said, sure, I will do that. So I dressed up as a clown and did put on the white face and decided I would not be a speaking clown, but a clown that uses mime. And I jumped out and I thought, this is kind of fun. And then when I thought, and then I was assigned in an area where we had kids in a grade school, and they asked me to teach religion. And I thought, how do you teach religion to first, second, and third graders? And I thought, I'll use the clown. And that's what I did. So I would dress up in my clown suit, take stories from the Bible, the New Testament, and I would act out. So if I wanted to teach them a story on sharing, I acted out the story of the fish and the loaves in my clown suit without words, and the kids would get it. So that's the clown ministry that I do. I've done, hour-long worship services in mime. Can you imagine? Going to church, listening to the sermon with your eyes and not your ears. No chance to fall asleep, let me tell you. None. So that's my clown ministry. So I've been doing clowning for about 30-some years, and I use it at Franciscan Health System. So thank you very much, but I'm happy to answer any questions about Franciscan Health System. Yes, sir.
I think I know the answer to this, but if you could perhaps explain a little bit more. I know, as you say, there's a lot of free or reduced medical services to people who apparently can't afford it. But by the same token, you hear occasionally of people going into bankruptcy because of their medical bills. So could you, without getting too complicated, explain a little bit about how you qualify versus how you go into bankruptcy?
Absolutely. One of the things that we, as a part of a national system in Franciscan Health System, what we do is if a person on the front end, we call true charity care, people who come to the organization or come to seek services and says, I don't have money to pay, can I work something out, and so we consider that true charity care. And so we will work with an individual with, paying their bill or writing it off or doing a reduced rate. And our policy is we actually use the HUD guidelines instead of, which are a little more generous than the national federal poverty guidelines. So we're above that. So we do. We have individuals file a charity application, and then we do that. Now, what happens, to your point, those who go in bankrupt usually are individuals. What we see is individuals who say nothing on the front end, and and they're given bills and what happens is we always try to reach out and work to those individuals, and what typically will happen is they go to collection, subsequently, bankruptcy. What our policy on that, and we're not as tough as organizations across the country. We do not send Guido out to, we will not put a lien on a primary residence. What we're finding, some of the things that we're finding right now, and we're changing our policy, our collection policy on this, is we're finding that a person's primary residence may be an apartment now that they rent because they're so underwater on their primary residence that they foreclose on that. We're changing our policy so that we're also not going after that property that is in foreclosure or in underwater. So we work very, very hard with the individuals. If we know that there is good intent, then we work very hard. We work very hard. And part of that is my role as mission, is to keep us on the straight and narrow. So.